I will be presenting today on the National Maternal and Infant Health Survey of 1988. This survey was designed to explore factors that cause negative pregnancy outcomes. This survey was conducted by the National Center for Health Statistics, which is housed within the Centers for Disease Control and Prevention, which is part of the United States Department of Health and Human Services. The National Center for Health Statistics is an agency of the United States federal statistical system which provides statistical information that helps guide policies and actions for the improvement of the health of the American public. Nutrition monitoring in the United States is a complex system of coordinated activities which provides information about the relationship of diet and health and related health status of Americans, their relationship between diet and health, and factors affecting their dietary and nutritional status. Data used for federal policy making includes food safety, food fortification, food labeling, dietary guidance, tracking progress of health objectives, and setting nutrition priorities. The National Nutrition Monitoring and Related Research Act was strengthened by the development of a 10-year comprehensive plan for nutrition monitoring and related research. And measurements are comprised of surveys, surveillance systems, and monitoring activities, with goals to collect quality data that's continuous, coordinated, timely, and reliable, that uses comparable methods for collection and reporting of results, conducting relevant research, and disseminating and exchanging information with users that's efficient and effective. The object or the purpose of the National Maternal and Infant Health Survey was to collect data that was needed by researchers to examine poor pregnancy outcomes. Low birth weight, stillbirth, infant illness, infant death, and factors that relate to poor pregnancy outcomes, like adequacy of prenatal care, inadequate or excessive weight gain, maternal smoking, drinking, and drug use, pregnancy and delivery complications. This was the first national survey that included data on these pregnancy outcomes. The study was based on questionnaires administered nationally representative sample of mothers with live births, stillbirths, and infant deaths. The study was a follow-back survey, which followed back to informants named on records. It used a national probability sample of registered births and fetal and infant deaths. Data was collected by mail, telephone, and personal interviews, and the data was linked with sampled vital records and weighted based on national estimates. Data was collected from 1988 to 1990 for the original study. The target population was women, hospitals, prenatal care providers that associated with live births, stillbirths, and infant deaths in 1988. The sample size and response rate is detailed in the chart. So the types were live births, fetal deaths that were classified as 28 weeks or greater in gestation, and infant deaths. The study is a nationally represented sample of 11,000 women who had live births, 4,000 who had late fetal deaths, and 6,000 who had infant deaths, all in 1988. The questionnaires were mailed to mothers, and it was based on their information from certificates of live births, reports of fetal deaths, and certificates of infant deaths. The information was supplied by mothers, prenatal care providers, and hospitals where the delivery was linked with the vital records. Summary of results include that mothers were more likely to respond if they were 20 to 39 years old, white, married, had fewer than 4 children, entered prenatal care early, had more prenatal visits, had more years of education, and resided in the Midwest region. The percentage of respondents were lower for teenage mothers, mothers of races and other than white, mothers with 4 or more children, mothers who had little prenatal care and had fewer years of education. Mothers whose infants weighed less than 2,500 grams were less likely to respond in the live birth and infant death components than mothers whose infants weighed 2,500 grams or more. This survey will provide valuable information for researchers seeking solutions to prenatal and obstetric problems. There was a follow-up study in 1991. It was a longitudinal follow-up that was conducted to obtain additional information about respondents from the 1988 study. This was a 3-component or 3-part study that provided information on early childhood morbidity and health. Part 1 obtained data on the national health issues affecting children, such as child development, effects of low birth weight, childhood injury, child care, pediatric care, health insurance, child safety, and acute and chronic childhood illnesses. There was a medical provider survey, which respondents to the original live birth survey were asked to provide the names of all medical providers and hospitals where their children were diagnosed, treated, and or admitted. The healthcare provider was then asked to supply information on the organization, the child's health status and history, and the visit or hospitalization. And the third part interviewed women who were identified through the 1988 survey as having lost a fetus or an infant during the study period. The information provided included the health and development of low and very low birth weight babies, their child care and safety, maternal health, maternal depression, and plans for adoption and health. These are the references for today. Thank you.